This practice was started by the late George Byram, MD, in the 1970s. He was the first guy out here in Metairie. East Jefferson was just starting. Dr. Byram started the practice and built it up, and it's sort of a legend out in this area. We've continued to provide services to people in basically the East Bank of Jefferson Parish and beyond for the last 4 decades.
One of the services that we offer is knee replacement surgery. Knee replacement surgery's been around for a long time. One of the more recent developments in it, though, is the use of computer-assisted navigated knee replacement surgery. And what the computer does in the operating room, by entering the anatomic landmarks into the computer, it helps to assure the proper alignment of the prosthesis.
In addition to computer-assisted surgery, there have been other advances in joint replacement surgery. Another way of doing a knee replacement is to do what we call custom block technology. This is using a computer ahead of time by getting a CT scan or a CAT scan or an MRI ahead of the surgery, and then the computer customizes the alignment of the knee replacement, and the factory actually manufactures what we call cutting blocks that we use during the surgery that's custom molded to the patient's knee.
I specialize in the training of athletes and also the treatment of athletes. So if there are any problems that you have that are athletic related, I specialize in that, as well as any trauma and orthopedics. So in taking care of the athletes, it requires to try and get them back into their sport as quickly as possible. And we do that with our team here. We have physical therapists and the assistants, as well as surgical and non-surgical management of these issues in order to try and get you back into the game quicker.
Much of my practice involves the sports medicine portion of orthopedics. This usually involves treatment of the high school and recreational athletes, but also involves patients who have had injuries at home and at work. Most of these injuries are usually treated with medication, exercise, physical therapy, and sometimes injections. But sometimes these need minimally invasive procedures and arthroscopic surgeries.
The majority of what we deal with is a lot of back pain and neck pain. Often we can just do procedures by placing a needle around a nerve that's irritated or an arthritic joint that's irritated. This is a 5-minute procedure, either done under sedation or without sedation. We do it at a surgery center with a live X-ray machine. There's other pain syndromes that can be treated through interventional procedures, such as using Botox. People who have had strokes and have developed contractures or a continued flexing of their arm or a limb can receive Botox to get better range of motion with that limb. Patients who have had chronic migraines, we can use Botox to help with decreasing the frequency of their migraines and also the intensity of their migraines. Also, a majority of other pain syndromes can be treated through simple interventional procedures along with medicines and physical therapy to help them get closer to having a better quality of life.
More than half of our patients that we treat in therapy are non-surgical patients that are able to prevent any kind of surgery and they achieve full recovery just with therapy alone. Our physical therapy office is conveniently located in the Metairie office, upstairs in the doctor's office, so the doctors get direct communication and updates on all their patients.
I think we continue to evolve and improve as time goes on. We practice here with empathy. We put ourselves in the patient's shoes, and we like to treat our patients like we want to be treated.